Gosh, it makes so much sense. I wish that 6 years ago I'd known what I knew now, but I didn't. And getting to share this with people and just spread the word because, Jan, I love what you said. It's hip to be healthy. Yes, it is. So like David said, my name's Dawn and I've been a registered nurse for 13 years. And, my story started 6 years ago when I found myself at about 30 years old. I was working at the bedside. I was a acute care nurse in a specialty float pool. So jack of all trades, I floated everywhere and really just ran. It was like from one sort of crisis to another, it seemed like, because I was working in a level 1 trauma center. But that was my passion. That was my dream. I'd always wanted to do that from a little girl. I wanted to make a tangible impact in people's lives. And so I really positioned myself right there where that would be. Had worked at the Mayo Clinic and in different places and just really was kind of searching for where I could make the most impact, I guess. But in the process of that, and I just have to take my hat off to all of those of you that are on the call or listening to this that are nurses in the front line right now, because you're incredible. And I would never take my education and my years in nursing away because I learned so much. And what we're able to give to those patients that we take care of and those families is incredible. But I felt like I was missing something. I felt like I wasn't able to tangibly impact these people's lives outside the walls of the huddle. And I felt like I wasn't able to create this relationship with them. And in my heart, I really wanted to know like how they were doing months down the road. And the worst thing was when I would see the patients come back in, right? I'd see them come back in 3 months later, 6 months later, and I would see that their diabetes had not improved. And I would see that their weight was heavier than it had been before. And that was starting to weigh on my heart. And it was starting to weigh on my mind. And through the process of that, I started to gain weight, the stress. I found myself about 45 pounds overweight. And here I was standing at the bedside, trying to help these people, trying to make an impact on their lives, giving them insulin and encouraging them not to eat the cheesecake that the dietitian just brought up, but not walking the walk. And that was important to me. And so it was actually one of the surgeons at the hospital that I think was just tired of listening to me complain at the nurses station and was like, there's this plan, there's this program, I think you should check it out. And I was really offended. And because you know what? I thought I knew what to do. And I was trying really hard. I would get up early before my 12, 13-hour shifts. I would go work out. I packed all my meals. You should have seen my little work bag. If I didn't lose my lunch on one of the floors I was working on, like forget which refrigerator I put it in. Normally I was trying to eat really healthy, right? But Donnie, what you said about the right fueling at the right time, in the right amounts for the right purpose, I wasn't able to like tangibly do that for myself. So through the process of this, I was able to lose 45 pounds. I was able to help my husband stop snoring. He lost 21 pounds. So this was 6 years ago. So fast forward and what life looks like now, I wouldn't have even been able to dream of then. So I found this program and I started it simply to lose weight, feel better, stop having back pain so that I could stop using all of my PTO at work, right? Because I was having a hard time there. But what ended up happening is people started asking me, what are you doing? How are you doing that? And pretty soon I had this group of nurses I was cheering on. My dad asked me, I shared in the chat a little earlier about how my dad and I really started this together. He was able to lose 127 pounds. And I think that's when I started seeing the possibilities of this really for people's lives, and not only their lives, but their families' lives and the communities, because I saw him get off medications. I saw my nurse friends able to finally be able to get pregnant when they'd struggled for years trying to. I found what actual creating health in our lives could do, and that was the tangible difference that I wanted to be able to make. That was it. That's what I'd been searching for in all these different areas of nursing. I'd even gone into becoming our staff nurse educator and educating about 75 nurses in our float pool. And that was wonderful. It was rewarding, but I'm sorry, fit testing masks for TV, like that wasn't really like lighting up my soul. And so I just started helping the people around me. And I can tell you, so I am truly a nurse. I have no business sense. Oh my goodness. But this isn't about that, because you can create the life that you want just from helping one person at a time. And I fell in love with health coaching one person at a time. And, now 6 years later, totally brought my husband home from his full-time job. He worked for Johnson & Johnson. He was a spine hardware consultant, but he had the hours of a surgeon. Right. And so now I was able to bring him home so that he was here to help raise our daughter. And then I came home from full-time working at the hospital. It's been a couple of years since I've set foot in the hospital with my nurse hat on, but I go up there to see my friends all the time. And Jan, what you shared about getting to live your life around what matters most. I mean, the picture of me on the river there, that was a Tuesday afternoon. My husband and I were both there. He was the one taking the picture. That's our little girl. I mean, that's what our lives can look like now, because I get to take care of my clients in the morning. I get to mentor coaches. We have this wonderful, thriving community where we all learn together and we help each other together. And I don't have to have business sense to be able to create an amazing life, and then to be able to help others do the same. So honored to be able to share this. It's a huge gift. And if we can even impact one or two lives around us, the ripple effect of that's amazing. I mean, finally now I feel like I have the tools to tangibly impact lives, and that together, this is the healthcare of the future. It's allowing people to take personal accountability for their own health. And I don't know a single healthcare practitioner or person in the world, or mom, who doesn't want the people around them and their children and their families to take personal accountability for their health.